It is Wellness Wednesday, and March is Colorectal Cancer Awareness Month. Joining us in studio for the sponsor segment, we welcome Dr. Mustafa Huseini, a gastroenterologist at Memorial Healthcare, talking first off about the causes of colorectal cancer. Good morning. Thanks for joining us.
Good morning. Thank you for having me.
Yeah, so let's talk about the causes. I mean, I feel like it's something that everyone needs to know about.
Absolutely. The two main causes of colon cancer, or the risk factors that make predisposed people to colon cancer, are mostly genetic or biologic, and then we have environmental factors. Genetic meaning hereditary or factors that are related to family history or personal history of colon cancer, and certain syndromes like genetic syndromes that cause patients to have a genetic predisposition to develop some abnormal structures, which we call polyps, which we'll come back to it a little bit later. And also family history in first-degree relatives, such as parents, siblings, children, and multiple second-degree relatives who have had colon cancer. So these are the main factors. And some modifiable factors or risk factors include medical conditions such as obesity, diabetes, excess intake of processed meats, and also excess smoking and alcohol intake.
Yes, so other factors can play into that. With all that said then, why is it important overall to have a colon cancer screening?
So the colon cancer screening is important because colon cancer is one of the more preventable cancers if caught early, and it's also curable. So routine, timely screening by way of different modalities that are out there can help detect polyps, and these are the precursors to colon cancer. And removal of these polyps is a great way to prevent colon cancer. There are other modifiable risk factors such as exercise, weight loss reduction, and weight loss and blood sugar control, etc. But those do not influence the screening. The United States Preventive Task Force and other GI organizations have recommended that people be all screened, and those factors are dependent mostly on the genetic factors and the prior history of certain syndromes such as ulcerative colitis or Crohn's disease. So that's what it's recommended, that people get screened in a timely manner.
Sure. Well, you speak of timely because I feel like there's been changes in the guidelines.
Correct.
When should people get screened and who should get screened?
That's a good question. So previously it used to be thought that age 50 was recommended for all individuals. However, over the last few decades, they have noted that more colon cancers have been found in younger individuals throughout the globe, actually. And on that basis, all the GI societies and World Health Organization and other preventive task force came together, and they recommended an age of 45 in average risk individuals. So it's best to talk to your primary care provider, discuss your risks. If somebody has higher genetic predisposition, they should probably get screened at an earlier age, but as an average individual with average risk, they should start screening at age 45.
Good information to keep in mind. Then again, March, Colon Cancer Awareness Month. And again, you can always find out more information by going to memorialhealthcare.org. There's a number on your screen as well to call. Thank you so much for your insight. Great information.
Thank you for having me.